I'm Matt Egan from the London School of Hygiene and Tropical Medicine. This is the second of our evaluation workshop presentations. In the last presentation, if you've watched it, you'll have heard me say that one of the key issues when you're designing evaluation is to not let the methods guide the research question. Always start with a research question. Always ask, what do you actually want to know? So this presentation is all about coming up with a good research question. This presentation was developed by me and my colleagues at Spiral, who are at the London School of Hygiene and Tropical Medicine. We're part of the NIHR School for Public Health Research. Okay, this presentation is going to have lots of lists in it, lots of lists of questions, lots of lists of do's and don'ts. First set of lists. 5 questions to ask before planning an evaluation. Here's what we think. First of all, objectives. What do you want to know and why? Secondly, resources. Thinking pragmatically, what time, money, staff is available to do this evaluation? Audience. Who's the evaluation findings going to be for? Why do they want that evaluation? What do they want to hear? What are they interested in? Evidence. What evidence already exists? What similar evaluations have already been done? What's already known? Is there even a case for not doing the evaluation because there is lots of evidence on this particular intervention? Theory of change. What do you think your intervention is going to do and how do you think it's going to do it? Theory of change maps out the kind of stages an intervention has to go through to plausibly have an effect on people's outcomes. Okay, this slide is just a recap from something we heard in the previous presentation about the kinds of things your evaluation might want to focus on, kind of things that might need to be incorporated into your evaluation question. And so you might want to focus on outcomes, which, as we discussed before, are the changes that happen as a result of the intervention, often for health interventions, changes in people's health. You might want to focus on processes. Was the intervention delivered as planned? Who was involved? Who was and was not reached, and what were the perceptions of the people involved, what barriers were there to success to the intervention, and what resources were required to do the intervention, how much did it cost? And we've added at the end unintended effects, unintended consequences. Often, particularly with complex interventions, there's going to be a whole range of impacts, some positive, some negative. And one of the purposes of evaluation is to try and capture some of those wider impacts. So here are some very basic pointers for coming up with a good research question for your evaluation. One you've already heard, start with a question, not with the methods. Also, a good research question should be clear, specific and answerable. And think of it as a hypothesis that needs to be tested. Another way of thinking about what your research question could be, think about uncertainty. Think about where the uncertainty lies. What is it that we don't know? Is there a controversy? Is there some debate around what works? Are different organisations trying different things and people want to know which is most effective? Ultimately, the evaluation should be about informing decisions. So think about the decision that you want to inform. Can your evaluation as you see it inform that decision? Let's consider some examples of problematic evaluation questions. A research question might not fit the decision you want to inform if it's either too broad or vague or too narrow. Or you might be asking the question that requires a large evaluation but you don't have the resources to carry out that large evaluation. In presentation 4 we're going to look a bit more on what you can evaluate on a tighter budget. A key point to bear in mind is that some ethical or more abstract questions might not make a good base for an evaluation. In fact, they probably won't. But an evaluation can provide observations that help people address some of these more abstract questions. To do this, you have to think about what is sensible to observe and measure and design the question accordingly. So some examples. Questions like, should we give books to prisoners? And should we allow parents to choose what goes into their child's lunchbox? These are, if you like, ethical or value questions. But to inform these decisions, we can design research that observes particular things relevant to them. So, for example, you could reframe a question for an evaluation along the lines of, what type of food goes in children's lunchboxes and is it healthy? Or, does the public find it acceptable giving books to prisoners? Or, what are the costs and benefits of providing a literary service in prisons? These are researchable questions that can then inform the more abstract or ethical questions. They can be observed, measured and assessed. Continuing on the theme of problematic evaluation questions, so an evaluation question can be problematic if there's no clear population or intervention, if it's not clear what it is you're actually evaluating, if you haven't really clearly defined the question that somebody needs answering, that is not going to be a useful contributor to someone's decision-making process. And with an unclear question, the study can sometimes never end and never produce clear conclusions. On this slide, we have something called the Peacock framework. And the Peacock framework helps you list off the kind of things that need to go into a good research question. So, P is for population. A good research question should specify who the intervention population are. That's what your evaluation is going to focus on. Also, besides just defining the population, you might want to consider whether there are subgroups in that population that you're interested in. In particular, from a health inequalities angle, you might want to know whether some people are benefiting from or being able to access the intervention more than others. And would this potentially widen or narrow health inequalities? The intervention, it seems obvious, but a good research question should definitely define what the intervention is, and it's sometimes easier said than done, particularly if you've got an intervention that's being conducted in different ways in different places. You will then have to start asking people to build up a picture of what the core elements of that intervention are. The C in Peacock is for comparison or control. So this is about you asking whether your evaluation is going to have some sort of comparative or controlled design, and if so, what's that control going to be? O is for outcomes, and as I've said before, this might be a single outcome. You're measuring the effectiveness of the intervention on a single outcome, but it can often, with more complex interventions, be a whole range of different outcomes. Sometimes the potential number of outcomes you can evaluate is very large, so it's up to you to start prioritizing which ones you want to focus on. And the T in Peacock is for time. So this is about specifying the time period for the intervention and your evaluation, and the time period where you expect some of your outcomes to appear. Obviously, some outcomes could happen quite instantaneously, quite immediately as a result of the intervention, whereas others, let's say a long-term health condition, could happen much longer down the track. The Peacock framework is sometimes worked through in different ways for different purposes. People add letters, take letters away. One of the more common reworkings these days is to change time for context, a second C. And the reason is because a lot of the more complex interventions and the more complex evaluations put a great deal of emphasis in exploring the role that context may have on both the delivery and the outcomes of an intervention. And context could be a whole range of different things. It could be the type of population or type of area where the intervention's being delivered, the setting. It could be the kind of people delivering it, how different teams of deliverers have a different role or a different impact on how it's delivered. It could be about the population. It could be about what else is going on at the same time as the intervention. I'd like to focus a little bit more now on the issue of outcomes, particularly what your primary outcome is going to be. Now, it's often considered good practice to pick a primary outcome for your evaluation and decide that that's going to be your chief measure of success. It is good practice, but sometimes it can be problematic, particularly if you've got a very complex intervention, and particularly if you're providing evidence for a whole range of different stakeholders who are looking for different things. They might define success differently. So here's an example again from urban regeneration programs. So urban regeneration, improving houses, improving neighbourhoods, improving communities. Public health researchers will obviously be interested in whether those sorts of improvements improve people's health or reduce health inequalities. Housing associations might be looking at improvements in their stock, improvements in household satisfaction or satisfaction with housing, and turnover of residents. Police might primarily be interested in crime and safety in their area. Community themselves might be interested in jobs and sense of community, and so on and so forth. All of these are legitimate outcomes. It's legitimate for all these different groups to want to see improvements and want to see these improvements evaluated. It's up to you as an evaluator to decide which of them you're going to focus on, or whether you're going to have to focus on all of them. Okay, so most of this presentation focuses on the evaluation question, But we're also going to look a little bit on how we end up answering that question, how we report our findings. So here are some reporting do's and don'ts. First of all, don't claim effectiveness unless you've actually got the evidence, which means, has your evaluation actually measured effectiveness? And if so, has it found it? Don't claim impacts on outcomes that you've not measured. Let's think of as an example where your evaluation has measured changes in behaviour. Let's say changes in eating behaviour. You want to say those changes in behaviour are conducive towards better health or lower weight. Well, it might be conducive, but but unless you've actually measured changes in weight or health that resulted from those changes in behaviour, then you have to be careful about what you can report, what you can say happened, and what you can say is plausible has happened. And do clearly differentiate between outcomes around knowledge, awareness, understanding, behaviour, and actual health outcomes. Yes, they're all connected, but they're also very different. Be clear about what you've measured and what you haven't measured in your evaluation. Here's an example of something you should be familiar with: food labelling. Now, I'm going to give you a simple theory of change, a simple theory of what needs to happen for this intervention to work in terms of changing people's behaviours and health. So first of all, people need to notice and see the food labels. Once they've noticed them, they need some sort of understanding of what is on those labels. Having seen the labels and understood what they're trying to tell them, the next thing is, hopefully, knowing what's on the labels will change their behaviour. That means they might eat more of products that they think are healthier and less of products that are unhealthier. And if they change their behaviour, then hopefully that will then have health impacts. So there's actually 4 stages there, isn't there? Now imagine you don't have that much resource to do your evaluation, and you've only measured the first 2 of those stages, noticing and understanding the label. And imagine your results are positive. You find that people do indeed notice them, and do indeed seem to have some sort of understanding of what's on the label. Well, that's fine, you can report that. What you can't do is then say that necessarily what has happened is people have improved their health as a result. If you haven't measured it, you can't say it. It works a little bit differently, I think, the other way around. If you find in your more limited evaluation that people generally don't even notice the label, then I think you do have plausible grounds for arguing that it's unlikely that this intervention has had any impact. If people haven't done that most fundamental thing of actually seeing the label that's supposed to affect their behaviour, it's hard to see realistically how that label can improve people's health. Okay, this presentation is going to end with just a long list of do's and don'ts to add to your evaluation planning, and I'm just going to read them off. So here goes. First, the do's. Do describe the intervention in detail. Do report qualitative data if you have it. Do draw on your own experience and judgment, but don't confuse your experience and judgment with actual data. Do consider using a range of data sources: surveys, qualitative data, routine data. Do stay objective. Do consider ethical issues. Do build evaluation in from the beginning or as early as possible. And do involve stakeholders. If you're a practitioner, if you're delivering this intervention, then it's good to consult with academics, researchers, professional evaluators to help you design your study. But it also works the other way around. If you're an evaluator, if you're a researcher, talk to and work with people who are delivering. Get an idea of what they actually want from this evaluation so you can deliver an evaluation that suits their decisions making processes. Also, consider involving the public. Arguably there's an ethical need to involve the public if, as taxpayers, they're funding research. Organisations like Involve can help you with public involvement. And now a shorter list of don'ts. Don't agree to evaluate or do more than is feasible. It's better to do a small evaluation well than a large-scale evaluation badly. If you've got lots of findings, don't cherry-pick the ones you like. Report everything. And don't forget to publish your findings in some sort of format, regardless of what they show. Again, this presentation, when it's delivered in workshop format, will end with an exercise for people at the workshop. And again, we're talking about people who are usually local practitioners of one kind or another, local professionals. So the exercise that we had planned at the end of this session was for each table of practitioners to try thinking of a research question related to a policy, initiative or evaluation that they're working on. And we asked them to use the Peacock framework that we discussed before and see if they could use that to frame a measurable, researchable research question around the initiative that they are thinking of evaluating. Again, we give them anything between 20 minutes or 30 minutes and get them to feedback at the end. And that ends this presentation.